All right, here we are. Well, welcome. Thank you for joining me today. I'm really glad that you're here. We're going to dive into ending Lyme and tick-borne diseases through prevention. So today I'm going to walk us through the different ticks that we see in North America and the pathogens that they might carry so that you know what to look out for. And then we'll go through the top tick-borne diseases and the symptoms that they can cause, so you know what to look for if you had a tick bite from one of those ticks. And then we will move into looking at ways to prevent tick bites. And then what to do if you get a tick bite, steps to take after that, if that happens, after all your prevention. And then we'll move into covering some of the acute tick-borne disease treatment plans briefly for the time that we have today. So thank you so much for being here. I'm really passionate about prevention because as a naturopathic physician, I had been working in Vermont since 2010 and seemed to arrive there when I didn't quite realize I was on the front line of this epidemic. I trained with Dr. Richard Horowitz in New York, who's an incredible pioneer in this field, and I learned so much from him. And he actually said, "Oh, don't worry, there's lots of Lyme in Vermont." And I really didn't know that it would be such a big issue. So I'm glad that I was in southern Vermont and see people from all over New England and help them on their healing journeys regarding Lyme and tick-borne disease. And so over time, I also started talking about prevention because sometimes people would get well and they were back to having their lives back and getting out there and enjoying life again and going hiking in the beautiful area that we lived in there. And then they would come back with a tick bite. So I would, create this handout and give them lots of information about different tips on preventing the tick bites because I would see, unfortunately, people would get Lyme a second time, a third time. And that is what I really want to help prevent. Getting Lyme or tick-borne disease in the first place. So I'm glad you're here and you're interested in this information. I hope that this will be informative for you today. So here we are. Prevention is the best cure. This is one of the naturopathic principles. So without an effective vaccine, accurate testing, or a simple, effective treatment, we have none of those things. Each of us, I think, must do our part to educate ourselves and each other in order to stop the Lyme disease epidemic. So let's go through some of this information here that is pretty motivating. So in 2022, we just got the new numbers in, actually. Approximately 63,000 cases of Lyme disease were reported by the CDC. However, recent estimates using other methods suggest that there are actually 476,000 people diagnosed with Lyme each year in the United States. And 10 to 20% of these people diagnosed with Lyme continue to experience symptoms. So it is important for healthcare providers who are challenged by these growing numbers to learn more about Lyme and tick-borne disease and prevention. And I think also just for all of us, anyone, whether you're somebody who enjoys the outdoors as a leisure activity, whether you're a gardener or a hiker, or whether you walk across your front lawn in a Lyme endemic area, you are at risk for a tick bite. All right. So some other information. Studies show that Lyme disease costs about $1.3 billion annually in medical costs in the United States. Federal funding for tick-borne disease is less than any other disease. The NIH and CDC spend a total of $97,000 on each new surveillance case of HIV/AIDS and about $47,000 on each new case of hepatitis C, compared to about $1,000 on each new case of Lyme disease. So Lyme and tick-borne disease have a tremendous impact on our physical, mental, emotional, social, and economic health. So I'm glad you're here today to help me end Lyme and tick-borne disease through prevention. All right, so here we go. We're diving into the ticks in North America. So what are ticks? Ticks are actually arachnids. They are not insects. The hard ticks, called exuded, these have a dorsal shield that we'll look at later, while the soft-bodied ergacid ticks do not. So this will come up later when we talk about tick identification. Ticks are parasites, so therefore they depend on a host's blood for nutrition. So they need to attach to you or an animal to get that blood meal to then grow into the next phase. And so this is why this is such an issue, because they carry these pathogens. They are vectors. So a vector is an organism that transmits a pathogen like Borrelia burgdorferi, which is Lyme disease, from a reservoir to a host. So with that background, we have this list of ticks that we're going to talk about today. So we're going to go into great detail. There's a lot of Latin here, so don't let it intimidate you. I'll definitely reference the lay terms like black-legged tick. That's our number one problem in the United States and in North America. But so we're going to go through all of these ticks and the pathogens that they carry. So yes, this is the guy. This is the public enemy number one, the black-legged tick. So we're going to talk a lot about this tick and the pathogens it carries. The number one tick-borne disease in America being Lyme disease. So this Ixodes scapularis can carry Borrelia burgdorferi, as we said, which causes Lyme disease. Also, another cause of Lyme in the US is Borrelia mayeni. Now, this is out in the north central states. And then there's Borrelia miyamotoi, which causes tick-borne relapsing fever. And since it is a Borrelia, that genus, they create very similar symptoms to Lyme disease. We can also see Babesia, Anaplasma. Ehrlichia murus is out in the north central states, and Powassan virus. And then we see a map here. So you're going to see on each of these slides the map that shows us where these ticks are geographically in the United States, so that you know, you can pinpoint where you live on this map or where you might travel to, so that you're prepared to look for these ticks. Now we have a western black-legged tick, looks very much like the eastern black-legged tick. And so they're out on the West Coast. And they don't carry as many pathogens, but they do carry Borrelia burgdorferi, of course, that causes Lyme, Borrelia miyamotoi, Anaplasma, and Babesia duncani. So here we have these tiny ticks, right? So of course they are hard to find. And this is just to emphasize that point. The nymph is on the left, and then the female adult is on the right. We're going to talk about how to identify ticks. But first, we'll also see the unfed female tick compared to an engorged female tick. So some people, don't quite understand how big these ticks can get once they feed. They will attach to an animal and feed for 3 to 5 days, and then they fall off. And because they're full, they will not be moving, but they're still alive, and they'll be digesting that blood meal. So sometimes people find these on the ground because maybe it was on them or a dog that brought it in and they fall off. So they look like a little pea or something like that. And that's to say, yes, actually it must have fed on somebody. So that's important to note if it's looking like that. And you can also tell that the abdomen, the body, is pretty distorted there. It's pretty blown up. But if you look really close to the mouth parts, you'll see that little round black disc. That is the dorsal shield. That will stay the same. And that is how you will identify that tick, because other ticks will certainly blow up like that after a blood meal. But looking at that dorsal shield will be able to tell you whether that tick is a black-legged tick or a different type of tick. And then down below, we have that really scary egg mass, right? So that's where all the ticks are born. And then they develop through this life cycle that we'll talk about. So it's actually a 2-year life cycle that the black-legged tick has. So we've got the egg mass. They'll turn into larvae. They'll start crawling around. They won't have much energy, so they're going to be not moving too far to find a blood meal. So somebody who's close to the ground. So they need to stay in a humid area. So they'll be in leaf litter, really close to the ground, like that. And so often their first blood meal will be from a mouse. Could be a bird, a mouse, something small to the ground. Then they'll develop, they'll grow another pair of legs and become nymphs. So this is when we start to see them. They can attach to a human. They have a little more energy. They might start crawling up that piece of grass, looking for somebody passing by. So that nymph can carry pathogens at that point. So at the larval stage is when they attach to that mouse that they usually get Borrelia burgdorferi. We'll talk about that a little bit more later. And other pathogens. So now, since they might have pathogens as a nymph, they can transmit that to you. Now, these are very small. This is the size of a poppy seed. So they're very hard to find. So tick checks are so important, right? And prevention is so important because it's hard to find them. All right, so next, after the nymph, sometimes they winter over, and now we've got the blood meal that they will have. They will become adults. Now they are the size of an apple seed. The females have that nice reddish tan back that people do tend to see. And then the females will attach again to an animal because they will need to lay those eggs. And that's, again, where humans might be the host. All right, let's take a look at the seasonal activity. So since it's a two-year cycle, there's definitely overlap. There's overlap with those 3 stages. But a lot of people notice these bookends, especially in the Northeast, in the United States and North America. So we will have the bookends of the adults come out. So right now, in April, we're seeing a lot of adult female black-legged ticks who are looking for a meal so that they can lay those eggs. So that's that green part. So March, April, May. And then after that, we'll see the nymphs. So those are the smaller ones, the poppy seed size. So some people think, oh, maybe we don't have as many ticks. They're just smaller. So please look for them. Then after that, we have the larvae, the smallest, the size of a period at the end of a sentence. Of course, we don't tend to get many larval bites, but it is possible, especially if you're really down in leaf litter and close to the ground, it is possible to get those bites. So we get, I hate to say this, but we might get a little bit of a reprieve August and September. So still be vigilant because like I'm saying, and like this graph shows, there's overlap of all these different stages, right? But we do tend to see a little bit of a quieter season there during those 2 months. And then people tend to get surprised. They say, oh no, the ticks are out again. And they've always been there, but yes, we definitely see in October, November that the adults are out again and we can see them better and they're definitely coming after humans. So something to be aware of. Okay, so now we're going to move on to the American dog tick. We're going to compare black-legged ticks to American dog ticks to other ticks. This tick actually in New England, we don't see that it carries pathogens very often. So that is a relief. However, again, I hesitate to say that because in other areas of the United States, they can carry Rickettsia rickettsii, which is the pathogen that causes Rocky Mountain spotted fever, and Francisella tularensis, which is the pathogen that causes tularemia. So it's really geographical. So just knowing about the prevalence in different areas is important. You know, is this tick carrying anything? And tick testing is super important too if you get a bite, which we're going to talk about later. So let's do a little bit more about tick identification. So of course we see, again, we're reminded at how small these ticks are. So we've got that in the hand there, the nymphs. And then just a little bit of a tick anatomy. The dorsal shield there I mentioned, so that's really close to the mouth parts. That solid round black area, which you see with the Ixodes scapularis, now that is really nice to find because that will tell us that is a black-legged tick and make you aware that this tick might be carrying Lyme or other pathogens. Now compare that to the American dog tick next to them. Now you've got that kind of, it is harder, it's a little white, it's a little gray mottled scutum, not solid. So if you compare those two dorsal shields, that's the way to identify a tick. And of course, you do see that is a female black-legged tick there, because we've got that nice little flag of the abdomen that's a reddish tan. And yes, that's helpful too. But like I said, that's the nymphs actually are just black. They're solid black. And if this female had engorged, it's not going to look that color anymore. So don't go by that way of identification. Look at the dorsal shield. Okay, now we have another tick, Lone Star tick. So these are actually making their way up north into the area of New England more and more. So we are starting to see them in Vermont, New Hampshire, and Maine. They have already made their way to New York, to Connecticut, to Massachusetts. So it's an interesting time since a lot of my patients are in upper New England there. And then south of there, yes, from Texas up north, we see Lone Star ticks. So these are interesting because they have a whole host of other pathogens they might carry. So they don't carry what causes Lyme disease, but there is currently an unidentified pathogen, and there's a lot of conversation about this. And if we had more time, we could go into it. But there's something called STAR-I, Southern Tick-Acquired Rash Syndrome, and this is thought to maybe be caused by a Borrelia species, but not all researchers agree on whether that's true and what the name or what the identified pathogen actually is. But it can cause Lyme-like symptoms. So that's important. I think that's going to be something we're learning more and more about, hopefully get to the bottom of soon. But they can also carry Ehrlichia, Francisella, which causes tularemia, the Heartland virus, and the tick saliva in this tick can create an immune reaction. The alpha-gal sugar that they carry can cause something called alpha-gal syndrome. So some people have a reaction to that sugar in the tick saliva that then creates an allergic reaction in their bodies. So their immune system reacts in a very particular way. Not everybody does, but some people do. And the symptoms of that would be things like hives or anaphylaxis, which is a trouble breathing, like a throat closing, maybe itchy, swollen lips and mouth and tongue. So that's actually not a pathogen that's causing that. Like most of what we're talking today are tick-borne pathogens. But the alpha-gal syndrome is also very important to note, because then what happens is people end up getting allergies to mammalian meat and products. So something to keep an eye out for too. And that can get better over time, but the only treatment is avoidance of those foods and products. So moving on to ticks, we're going to come back to talking about ticks and the brown dog tick. This is a tick that we don't see much of unless you have something like a kennel or a lot of dogs. If you're breeding dogs, you might deal with infestations of a brown dog tick. It rarely carries rickettsia, but it can, which causes Rocky Mountain spotted fever. And humans don't, it's uncommon for a human to get bitten, but it can happen. So it's something to be aware of, especially in these kinds of situations with dogs. And what can happen is it can be more of an indoor infestation, opposed to the other ticks we're talking about are more of an outdoor issue. Of course, if you bring them in, they can survive for a day or two, and you need to be careful of that when pets are bringing in ticks. But this tick is a little different in that way, where you can have actual indoor infestations. And now we have the Gulf Coast tick. So as you can see, this is more in the southern states in the United States. And this tick can carry Rickettsia parkeri, which causes a Rocky Mountain spotted fever-like disease, and Ehrlichia chafensis. And now we have the Rocky Mountain wood tick. This is a tick that's out in the West, as it sounds. Rickettsia francisella, causing tularemia, and Colorado tick virus are the pathogens that this tick can carry. And then we have ornithodoros ticks. So this tick looks a little different, right? So no dorsal shield here to identify. This is an argacid tick, a soft tick. So they look a little different, and human hosting is incidental. So it can happen though. And this tick can carry Borrelia species. So these are the Borrelia that cause tick-borne relapsing fever, which is similar regarding symptoms that Lyme can cause. However, as it sounds, you can get these relapsing fevers. So a lot of times, like the places that you can find these ticks are in places like caves or old cabins, wood that they live in. If you're camping in a structure, they might be there and inadvertently come out at night. So they feed only at night, and they only attach for about 15 minutes. You won't even know it, and then they're gone, but they may have transmitted this pathogen. So these ticks are a little different in that way too. That's interesting. And they're more out west and a little bit in the south. And lastly, we've got the Asian longhorned tick. So this is just caution. We don't know where this is going. This tick arrived several years ago, or maybe now it's probably a decade or so, from Asia. And in Asia, it actually carries a lot of pathogens. So interestingly here, pathogens have not been found to cause diseases in humans after an Asian longhorned tick bite. So fingers crossed. We may not have to worry about this one, but there's just a lot of surveillance. There are some eastern states that have some distribution of this tick, but no known human disease yet. So we shall see. So now we'll talk about tick attachment times. A big question for people because of a lot of things that they read out there is, the tick was on 12 hours, 24 hours, 48 hours. Like when does it actually transmit pathogens? And, I get these stories of my patients going to urgent care and they say, well, has the tick been on 48 hours? And they say, well, no, I don't think so. And then, no action is taken. So I think it's really important to first acknowledge if you knew when it attached, you wouldn't have let it attach, right? So if you saw that tick crawling on you before it attached, you would have taken it off. They're pretty small. And if you find one on the back of your knee, you may, who knows how long that's been on if it's not an area of your body that you're looking at very much, right? And people are often surprised when they take that tick off and then they show them and they're like, oh yeah, I think I got it last night. I was out, I went for a hike and I must have gotten it then. And they show me this huge engorged tick that clearly was on at least a few days, because that is one way we can tell regarding how engorged it might be, regarding how long it has been attached. Anyway, we'll move on here to this chart, and you can see the minimum recorded tick attachment time resulting in transmission of pathogens from a tick to a human. So we've got Borrelia. I know it's all the Latin names. So we've got Borrelia burgdorferi. That is the cause of Lyme disease. And 4 hours, there's actually documentation that it only took 4 hours. Now, most studies aren't looking at that short period of time. So most of these transmissions are recorded at 12 hours or 24 hours or after that. So I think we need a little bit more research on this to really pin this down. But interestingly, it just seems like some ticks take longer than others to transmit. Borrelia or other pathogens. And so we've got Anaplasma is 12 hours, Babesia is 36 hours. And, could it be transmitted sooner? Was it researched at 4 hours or 12 hours? These are all really important questions to look at. And then later, these tick-borne relapsing fever pathogens, Borrelia hermsii, Mayeni is the other cause of Lyme disease. I was going to say hermsii, Turicate, those are both 15 seconds, right? So very, very quick. So those are attaching at night, for people who might be inadvertently the hosts. And then Powassan, also really important, 15 minutes. So of course, Powassan virus is rare, thank goodness, because it can be fatal. It's very rare in ticks, but it is transmitted very quickly if it is carried by a tick. Yeah, so you can take a look at this chart. There's some we don't know how long they take to transmit, and I think this is really important information. So, with this information, just to say, we want to prevent these tick bites in the first place, right? Because some of them are 15 minutes and 15 seconds. Second is to say, don't go by time. I don't really go by time if somebody says, oh, I could not possibly have this on for more than 4 hours, unless it was, right on their arm, somewhere they're looking at all the time, right? If it's somewhere on your body, you just really may not have noticed. And there are so many ways that we can get these tick bites. So also to think about, to make it more complicated, is that partially fed ticks actually have a shorter transmission time on a second host. So if you have a tick that attached to, say your dog or an animal or something, and that feeding was interrupted, they fell off, and then they found you, they're sort of primed. So it doesn't take as long for this tick to transmit the pathogens. And 10% of those ticks out there actually have already had a partial blood meal, which means they are primed to do that. And for these classification of ticks out there, within 24 hours, 83 to 100% of those partially fed nymph ticks will transmit Borrelia burgdorferi. And within 48 hours, 100% of them will. So this is really important information to say, it's quicker for these 10% of ticks. So it may be that somebody had a tick bite from a partially fed tick, and that's also why this whole idea of how long does it take to transmit Lyme gets a little fuzzy. All right, so with that, we'll spend a little time talking about Lyme and tick-borne diseases. So we're going to see this huge map of diseases out there that cause Lyme and tick-borne disease throughout the whole world. So this is a really detailed chart here. But today we're just going to go through three. We're going to talk about Lyme disease, anaplasmosis, and babesiosis. So Lyme disease, as you may know, was discovered in Lyme, Connecticut by Dr. Alan Steer, who was seeing a lot of children with what he thought was juvenile arthritis. And in 1975, it was realized, there's actually an infectious cause to this. Just a little later, in 1982, just across the Sound into Long Island, New York, Willy Burgdorfer discovered the bacteria in these ticks. And of course, was named after him, Borrelia burgdorferi. Of course, we know Otzi is this Iceman that was discovered in the last decade or so. And there was Borrelia found in him. So we know that Borrelia, the cause of Lyme disease, this bacteria has been around for over 5,000 years. So getting more into the signs and symptoms and what to look out for after a tick bite regarding whether you might have acquired Lyme, the symptom onset is 3 to 30 days after a tick bite. So I always want people to watch out for symptoms, watch for that rash if it happens, check that site of the bite for 30 days after a tick bite. And just a little bit about the Borrelia burgdorferi bacteria and the ways that it can hide in the body. So this is our shapeshifter. We see that spirochete on the left. So it's a little bit of a interesting way that it exists and moves in the body. And that spiral nature of it, it can really get into certain tissues like the connective tissue, which it loves. But it can change forms and become dormant. So we've got our cyst form, which is also called the round form. And when it's in that form, it's not going to respond to antibiotics, and your immune system is not going to see it. So it's really important to acknowledge that this has repercussions on how we choose treatment and thorough treatment for Lyme disease. And here we have biofilms. So these Borrelia, these bacteria create communities surrounded by this biofilm, and it's a slimy mass of basically proteins and polysaccharides, and it protects the bacteria from the changes in pH and temperature in the host. So this is a way that it protects itself. And again, antibiotics don't get through that biofilm. So we need to use other things in our treatment. In my training and as a naturopathic doctor, I use a lot of herbal medicine. And for instance, serrapeptase breaks through this biofilm. So we'll see that later in our treatment plans. So looking at Lyme reported cases from 2001, you can see in comparison here, now 2022, all the little dots and how we're seeing them in all the other different states and not just in the Northeast, right? So that's the CDC way of surveilling anyway, but it's a little bit about that. And the CDC actually claims that incidence is higher than reported, and I think this is really important. So in 2019, they reported about 35,000 cases, but they admit that this figure only represents 10% of the cases meeting the criteria. So they're saying actually there's probably 350,000 new cases that occurred in 2019. And then we have this other study from 2010 to 18. They were saying actually it looks like 30 to 40,000 cases of Lyme were reported by the CDC. However, health insurance claims data showed that 476,000 patients were diagnosed annually from that period of time. And now, as I had shared earlier, we have the 2022 numbers in, 62,000 new Lyme cases. And this is a 68.5% increase compared to the 2017 to 2019 average. And the incidence, I think it's important to note, is really increased, almost doubled in the population of people over 65 years old. Now, of course, there's also discussion about, well, why is this number so much higher? The CDC actually changed their criteria, which is a good thing. It's more inclusive of what needs to be looked at. And if we apply that idea of the 10%, maybe it's actually 620,000 Lyme cases in the last year. But let's get into the signs and symptoms of Lyme disease so that you know what you need to look for after a tick bite. So here we have our erythema migrans, the bullseye rash. It's not always perfect like that. This is a great picture. It's great if this happens. I joke with my patients, they might come in, they have a fever, they feel horrible, they missed work, they have this bullseye rash, and they just feel horrendous, right? And I'm like, this is great. We found the bullseye rash. So it's a great signal to say, okay, you have Lyme disease. Let's treat it. We're treating it early. It makes all the difference to treat Lyme early so that you do not have consequences of neurological consequences, other symptoms that can come up and cause trouble long term. So you might have that short term, really just a few days or a week or so of feeling pretty awful. But with treatment, people feel better pretty quickly. So look out for that bullseye rash. However, it happens less than half of the time with people who have been diagnosed with Lyme. Only half or less recall a bullseye rash. So this develops within 30 days after the bite. And really the criteria is that the rash is more than 2 inches in diameter. So what I recommend people do, right after a bite, you might have some local irritation. That's very normal. You had a bite, right? So it might be, half an inch or less around, some redness. That's just because of the bite. This rash is actually a skin infection. So this will happen later. It's not going to happen immediately at the tick bite site unless it's been on a while, I guess I should say. But again, the size, if it's just really local, that's just the bite. But if you're seeing that it spreads outward and it's more than 2 inches in diameter, that is really important. And we'll look at all the ways that it can appear. But what I say is, okay, if it's getting to that 2-inch mark, make a circle, take a pen, draw a circle around it, take a picture, document it, send it to your doctor, hopefully a Lyme literate doctor. And then, if several hours later it changes and it keeps growing, because that's what this rash does. Untreated, it will grow and then it'll just disappear. So it'll get distorted over body parts. So just to keep an eye on that. So here are some different ways that it can appear. So we've got diffuse borders. Then we have this larger lesion on the chest. Hard to see, but if you go outward, you see that border there. And then the blister. And then there's the disseminated rash. Now these look like target lesions, right? But you can have multiple target lesions all over your body. So that could be confusing. Most, the other rashes that we're looking at are going to happen right around the tick bite, but then this disseminated rash can be all over the body. Also very important to look out for. And then we have the back of the shoulder. So this is kind of to say, oh yeah, if this was on the back of your shoulder, usually these rashes do not itch or hurt. You may never notice that. And maybe that's why people don't notice, because they're not looking, right? So if you had a tick bite, if you have a known tick bite at least, please keep looking for the 30 days at that area. Use a mirror, ask for help, so that you can check in on that to see if that rash has occurred, because the first sign might be a rash without any other symptoms. So if we could find that and get it treated, that's the best. So then here we have a darker skinned individual, and you can see how different that looks and how hard that is to see. On the back of the knee there, that's an erythema migrans. So Black patients have 5 times the odds of disseminated diseases, for disseminated disease of Lyme disease. So disseminated meaning, they are less likely to see the erythema migrans, Lyme rash, and more likely to come in with the fever or the Bell's palsy or joint pains, joint swelling as a Black patient. And so that means that they've missed that earlier window to get the treatment. So if you find an erythema migrans, you're going to have and you treat, there's a better outcome. So just something to be aware of. It's harder to see. So if you have darker skin, please, take the extra time to really try and find that bullseye or that Lyme rash if it's there. And doctors and practitioners out there, please, be aware of this and educate your patients on this. Okay, so signs and symptoms beyond the rash. But just to say, yes, we know we've talked about the rash, but other things, it could be warm to touch, but it doesn't have to be. It could be flat, it could be raised, it could look all these different ways, right? So then also we're looking for flu-like symptoms, fever, chills, sweats, that fatigue, like you have the flu, a headache, swollen lymph nodes, especially near the tick bite site. So that could be in the neck, but if it's a knee, a bite on the leg, it could be a knee, it could be the groin, where you have, lymph nodes all over your body. And then joint pain, joint swelling, muscle pain, fatigue, headache. Then we can have heart symptoms. You can have AV block as a cause of Lyme disease. So chest pain, shortness of breath, palpitations. These people need EKGs, and that needs to be diagnosed right away and treated properly. Eye symptoms, you could have itching, burning eyes, redness of the eyes. And the neurological symptoms, acutely, early on, you can have Bell's palsy, which is a facial nerve palsy. Usually it's one-sided, and that's where you lose motor control of your face on one side. So you'll see a drooping eye, you're closing the eye, you won't be able to close the eye, or the mouth. Some people notice this first when they're drinking, and then they're dribbling out the side of their mouth all of a sudden. So that happens acutely. Other neurological symptoms can take some time to develop with Lyme disease, things like tingling and numbness, cognitive changes, personality changes, many different things, as you can see, that one can experience with Lyme disease. And then just a note on pediatrics, I think it's important to share that the highest proportion of new cases of Lyme disease are in 5 to 9-year-old children. So please think about your kids and protecting them. We want them to be outside. Nature is so important for our health. And in the area where most of my patients are, we just have a gorgeous landscape, and you want to get out there and enjoy, right? And I want you to do that. But please, we'll talk about so many preventative options that there are. So please engage with some of these strategies so that you and your kids can be protected. Sometimes with children, Lyme can manifest in different ways, or, of course, depending on how old they are, it's hard for them to communicate or know, like, something's wrong and what is it. So sometimes how we see it manifest is through developmental delays. So if you have a known tick bite, and then after, time is marching on, and, speech or motor coordination, all the different developmental stages, like there's something that's off or that's not happening, that can actually be a sign of Lyme disease. Sensory integration problems, behavioral changes. Sometimes with kids, it's more digestive issues that come. I don't really see that much in adults, but with kids, I do. And of course, they can have some of those other symptoms. And if they have a swollen knee, that is very, very classic for pediatric Lyme. But these are some other symptoms that they might have, or that might clue you into saying, there's something wrong, there's something that changed. Let's get this checked out. Let's get a Lyme test. Okay, so we've talked about Lyme disease. That's the big one. Anaplasmosis is the second most common tick-borne disease in the United States. So let's talk about that. These are carried by the black-legged tick. So same tick as what carries Lyme. And this was discovered in 1993. It's a gram-negative bacterium that infects granulocytes, these specific white blood cells. And the onset of symptoms is from 5 to 21 days after a tick bite. So here we have the map. So the darker the purple, then it's, the more cases or higher incidence of anaplasma is seen. So the Northeast and the North Central states are the top areas. And so here are the signs and symptoms. Now, when I see people with anaplasma, often they might call, and I might see them, very quickly, or they might go to urgent care or the ER, because this is high fever. We're talking 104, 105, severe headache, worst headache of your life. They're usually stopped in their tracks. Something's very, very wrong. They're not able to function in their day, and they seek out help. So often you will know if you have anaplasmosis. So if that happens after a tick bite, please get that checked out and mention that you had a tick bite. So other than those symptoms, muscle pain, fatigue, flu-like symptoms, you can have a little bit of nausea, vomiting, or abdominal pain. It's a little more rare. Cough, a little more rare. A rash can happen. This is very uncommon, but it's kind of this splotchy rash around your body. That's not on the face, palms, or soles. But mostly it's the top of the list are the symptoms that I see. And luckily, anaplasma can be easily tested for, diagnosed, and treated. So unlike Lyme, where we have lots to talk about there, anaplasmosis is easily treated with 2 weeks of doxycycline, which is phenomenal. So if you get that diagnosis, which the testing is also very, very good. We'll talk about that with Lyme too. The testing isn't very accurate, unfortunately, with Lyme disease, but it is with anaplasmosis. So there's a lot on your side, even though, again, acutely, you might feel absolutely horrendous. There is an answer, and you will feel better soon. So getting that attended to is quite important. All right, babesiosis. So we've got the third, the third top tick-borne disease. Ehrlichiosis is also out there, which is similar to anaplasmosis. We only have so much time today, so we're not going into every tick-borne disease, but this one's also high on the list. So this is passed through the black-legged tick bite. So first diagnosed in 1966. This is a protozoan or a parasite. So I also think it's important to note, because of that, a lot of the tick-borne diseases are bacteria. So this is treated differently. It infects the red blood cells, and it's very important to note if you have babesia, because you need to get the right treatment. Some people are actually asymptomatic, and it will resolve on its own. But then it really runs this range of, some people it can be fatal. So the symptom onset can be several days to a few months after a tick bite. And here's our map. So the more orange, are going actually into purple, brown, the higher number of cases of babesiosis. So again, mostly Northeast, but also around the country. And signs and symptoms. So again, fever, acutely, any of these tick-borne diseases will cause fever. Fever, chills, fatigue, headaches. Headaches for babesia are more like a pressure headache. Muscle pain and joint pain. Joint pain isn't too big in babesiosis. But remember, you could have Lyme and babesiosis transmitted. So these ticks might be carrying multiple pathogens, and they can transmit them. So it might be a mixed picture. And so getting thoroughly tested and treated is really important, especially when we're dealing with a parasite like this that requires different treatment. A classic presentation of babesia that I see is excessive sweating, especially night sweats in men or women that are not near menopause. Is very odd, right? Heart palpitations and chest pain, which those can overlap with Lyme symptoms. Air hunger, this very particular description of this difficulty breathing, but it's not on exertion. It could just be sitting or laying down, and people feel like they just don't have enough air. That's how it's explained. And also this kind of cough that can go with that. That's not a productive or upper respiratory issue kind of a cough. All right, so we've made it through ticks and some of the tick-borne diseases, so I hope you feel more equipped on those notes. And now let's get into tick control and tick bite prevention. So understanding the tick habitat can help set us up to understand how to strategize against getting rid of ticks or protecting ourselves. Ticks can be active above 28 degrees Fahrenheit, most active above 45, and with at least 85% humidity. That's their time when it gets to that point. So, we're getting there, and especially on these rainy days, or, the humidity in the Northeast in the summer can be quite high. So, and, all through the country in different areas. So something to keep aware of these factors. Where do they like to be? They love to be in borders, like where the transition zone is from grass to woods. They like to be around gardens and wood piles, stone walls. If you have debris or a shed and this transition zone around that. They love being under leaf litter, moist areas in the shade. And they need hosts. So thinking about that, so they need small mammals. So if you have a lot of mice or voles or whatever small animals around, that is going to give them the host they need to get the blood meal. So thinking about reduction of the tick population in the landscape is really applying all that information. So let's rake up the leaves, be careful while you're doing it, please be protected, trim the shrubs, keep the grass short. Keeping it short will not prevent ticks from living there, but it will decrease the humidity and allow the wind to get in there a little more in the sun, so you might have less ticks. Clear your brush and debris from your gardens. You can create wide paths to walk on, or if you're going out, into a hiking path or something, just thinking about, let's not walk through the long grass, let's choose the path that has stones or just dirt or whatever. You can create some transition zones of cedar chips, around your property, between the grass and the woods, if you live in such a place. Remove or move bird feeders to the perimeter, like move them out. Don't keep them close, because those birds can carry the ticks and drop them off in your yard. Move the garden or playset from the perimeter, so you're not out in the areas that they are. And then thinking about deer, using deer fencing or using plants to repel deer, and then using tick tubes, which we'll talk more about. So here's a little picture about all this, just thinking about a typical sort of suburban place which you may or may not live in. And then we have host management. So thinking about our white-tailed deer. So, deer are talked about a lot regarding Lyme disease. And it's interesting. It's interesting because they actually don't carry Borrelia burgdorferi. And so even though they don't carry it, what happens is they will sustain the nymphs and provide a blood meal for the adult females who need the blood meal to then lay those eggs. So 90% of adult Ixodes scapularis, which is our black-legged deer tick, feed on deer. That's a lot, right? So they're an integral part of the tick life cycle, is basically the issue there. So deer reduction is talked a lot about. It's been interesting. Like, it was very, very successful on this island in Maine to eliminate deer and have an impact on ticks in a great way for us, not to have ticks there. But it doesn't always pan out that way. So it's an interesting topic. And something that's been used, that's been researched and pretty successful, something to consider, although there's a little cost to it, is this 4-poster tick control deer feeder device. So, it has been looked at that it has decreased the black-legged population by 50% in the 3rd year, 60-something% in the 4th year, and 70% in the 6th year of use. So this is kind of like a long-term commitment. We see that it's more effective over time as you utilize this. And what it is it's an area where deer can come to get bait, and while they're there feeding, there are these vertical poles that have permethrin rollers on them, and so they get that permethrin on them, which treats the deer's head to kill ticks. So permethrin we're going to talk about, and it is a chemical used. We can use it in a lot of different ways, and there's a lot of conversation about the safety of that. But it seems pretty good for this, this idea of decreasing ticks on deer, which therefore can have the impact of killing adults before they lay those eggs, right? So that we have a whole new generation we're going to prevent of ticks. So just a word on permethrin. So this is a pyrethrum, which is a constituent in chrysanthemum flower. And it has been used for over 2,000 years to repel arachnids like ticks and insects. Permethrin, though, is synthetic, right? So it is potentized and changed to a certain degree where it has more effect. So now it's an acaricide, an arachnid killer, created in 1973. So this permethrin, this chemical, will paralyze ticks by changing the nerve function through the nerve membrane sodium channels. So what's important for us is to remember that it's toxic when it's wet. So we'll talk about different applications of this. So if you're using it to spray your shoes and socks down, you're going to want to wear gloves to do that. It is safe for humans and pets once it's dried onto the material, but it will still repel ticks. However, environmentally, it is highly toxic to freshwater and aquatic organisms, honeybees, and other beneficial insects. So when we're thinking of spraying it on the environment, that's a different story. Low toxicity to birds, at least, but yeah, it's definitely a big topic of discussion. All right, we also have another host, the white-footed mouse. So let's talk about them. So 75 to 95% of the larvae, that first stage, that little itty bitty Ixodes scapularis black-legged tick, becomes infected because it fed on this mouse, right? So when ticks are born, well, there's Borrelia miyamotoi that can actually be transmitted, which is pretty rare. We don't see a lot of it, but that's true. But Borrelia burgdorferi and other pathogens are not transmitted in that way from mother to child, so to speak. So the tick needs to become infected by taking a blood meal on an animal. So usually, like we talked about, they're going to go for a small animal like a mouse, and it's where they get infected. And then after that, they're nymphs and then adults, and those are the ticks that really go after humans. So then they can transmit the Lyme or whatever pathogen they got from the mouse to the human later on. So this is a really important concept because we could actually think about interrupting that process, right? We want to target the mice or specifically the ticks that are attaching to the mice, right? So tick tubes are really a wonderful invention. So I recommend this all the time. I've used them myself, and every year I get feedback from my patients saying, wow, yeah, it really made a difference in our yard. So you can do it yourself. You can I have a video out there with Project Lyme, which is an awesome organization. If you want to find it, it's on my website. If you want to find some instructions regarding how to make your own tick tubes, but you can also buy them. And so the idea is that we're going to treat some cotton balls, or you can save dryer lint, and anything you think a mouse might like to bring to its nest, right? So you treat that with permethrin and then let it dry. Wear gloves when you're doing it, protect yourself, right? Then stuff those tubes, so you can save paper towel tubes or toilet tissue tubes. I have people that actually just make PVC tubes that they reuse year to year. So that's great too, whatever you want to do. And so you stuff that material in there, and then you put them out into tick habitat, which is mice habitat, mouse habitat, same thing, because the mice will go and bring that material back to their nests, and then it will kill the ticks on them and their family members, and is incredibly effective. So there's a little picture giving those mice some nice material for a soft bed. And so we have some research. So over an 8-year period, there was a 93.6 reduction in exposure to ticks on humans as a result of using these tick tubes in New York. So incredible. And that's what I hear all the time. It really makes a big difference. And I would put them out. I would put them out 3 times a year. I mean, depending on where you're located, right? Say in the Northeast, I'm thinking now, depending on where you are and if there's still snow or not. April, May is a good time to do it. And then, midsummer, and then like maybe October, right? Because those adults are going to be coming out in October. So that would be a good schedule. All right, so let's talk about treating the landscape. So we have our lovely yard with our mouse and our deer. So first to just talk about, what's the industry standard, right? And for better or worse, what's the most effective treating the landscape is using something That's a pyrethrum called bifenthrin, which is the most commonly used, but there are many options. So this is a synthetic pyrethroid as well, like permethrin, that paralyzes ticks and therefore kills them. And now we're talking about treating the landscape with this. Then what are the consequences? Yes, it's highly toxic to freshwater aquatic organisms, honeybees, insects, toxic to birds to some extent. So there are alternatives as well. And there's a lot of research, more and more, and it's great. Every few years when I really look into it, it's like, okay, maybe we're getting closer. So hopefully we can find a really great way. And usually I'm just thinking about doing multiple things. Like if you've got your tick tubes, they're working great, but maybe we need to, think about, do we want to use some essential oils on the landscape as well? And then there's the tick bite prevention on the person that we're going to talk about too. So thinking about essential oils as an alternative. I mean, these are potent substances. They are organic volatile compounds that are produced by aromatic plants, like peppermint oil, cedar oil. You may have used essential oils before and know about and how strong they are, right? So they, in nature, in a good way, they attract pollinators and seed dispersers to the plants, like honeybees and that sort of, bumblebees and that sort of thing. And they also repel and protect the plant from microbes and predators. So the thing is, it's a challenge to evaluate these studies. So there are actually a lot of studies on this topic, and it's just hard to, there's no like standardized method to really evaluate this. And so that in itself is actually being discussed and trying to bring a little bit more of a methodology to it so that hopefully, all the really detailed questions can be answered and something could really be brought from that to create the right application and know how to use these in this way. So I think it's promising. So so far what we have is something called eco-exempt IC2 has been really effective. I mean, the thing is it's short term, but while it's effective, that's pretty great. So this was being carried by like local pest controls. So I've had patients who, instead of the permethrin type pyrethroids being sprayed on the property, they might get eco-exempt IC2 from a pest control company. Some carry it, some don't. Definitely ask if you're interested, and they can get it. So so it's an alternative, it's an option. And it suppresses 100% of the black-legged ticks for 2 weeks, right? So versus bifenthrin, it's not as long-lasting. So we definitely need to acknowledge that. So how often do you want to, be applying this stuff? But it can really, it has quite a knockdown effect, as they call it. So that can be very useful. And then it also suppresses just the larvae of the black-legged tick, 63% of them for 5 weeks after the spray. So not the nymphs or the adults, but that's great. And then it suppresses 93% of adults for 14 weeks after the spray. Sorry, I got that backwards there. So, even 14 weeks post-spray, that's pretty amazing. So you've got some of the larvae that are still hanging out, but most of the adults are addressed. So something to consider. This one required an emulsifier to add. So then this Accentria IC3 was created, and that one no longer has that emulsifier that you have to add, but then there's some discussion about it being less effective. So that's a downside. So the thing is, this eco-exempt IC2 is now harder to find, but that's the more effective one. So if you can find it, that's the one I recommend compared to Accentria IC3. And in the meantime, nude ketone overall in the literature looks like the most efficacious essential oil. So the thing with this is it's not out, it's not commercially available yet, and it's actually been several years. And I was hoping, I was writing my book. I mean, that was, the book came out in 2020, so it was much before that I was hearing about Nutkatone. I was so excited about it, and it's still not out, but it's apparently being worked on, and will be released to the public at some point, I hope soon. So this is a sesquiterpene. It's found in the essential oil of grapefruit and the yellow cedar tree. So 5% Nutkatone suppressed 100% of nymphs for 2 days. So that's pretty amazing too. And then up to 65% up to 21 days. So again, like standardization of these studies, like how does it compare to the IC2 and all of that. But also we're going to see how this seems to be more effective when we use it as a repellent on our skin, and it's safe for our skin. Carvacrol was also studied in this research study. So that's a phenolic monoterpenoid in essential oil plants like thyme or oregano, black cumin. You'll find that compound, and so it also completely suppressed nymphs of both the Ixodes scapularis, which is black-legged tick, and the Lone Star tick is the other tick they studied, through 2 days, with a significant reduction, and then even 14 days post-application. And then we have another study looking at 2%. Nutkatone suppressed 96.5% of black-legged ticks after 42 days. So that's pretty incredible. And 91.9% of the Lone Star ticks after 35 days. So this is, again, pretty promising for that Nutkatone, and just trying to think of, okay, what's the concentration we need? All of that needs to be sorted out. And then there's this other, in the study, they also looked at Carvacrol 2%, and it suppressed 92.3% of black-legged ticks and 92.3% of, 92.9% of Lone Star ticks. And then also as a comparison, they had this different essential oil formula that had rosemary and peppermint and wintergreen, and it suppressed 90% of black-leggeds and 87% of Lone Star ticks. So, there's some great research out there, and I'm hoping it's bringing us closer to having some alternatives to using such toxic substances out in the landscape that affects the environment. So now we will move on to tick bite prevention. And so thinking about on our person, right? We talked about the landscape, so now we're going to talk about, you going out into your yard or into the garden, or just walking across a lawn, or going for a hike or camping or whatnot, what to do. So we have some high risk populations that we'll talk about. And if you're a farmer, it could be your hobby, or it could actually be your living, right? I see a lot of people who work on the electrical lines, and they have high risk for tick bites. If you work in an oil field, a railroad, or if you just love to go hiking and camping, or playing sports outside, horseback riding, and then an occupational hazard that's not outdoors, but as a veterinarian, there's a high risk for getting tick bites because of those animals that you're dealing with and the ticks that they carry. But ultimately, right, just going out, even if it's just a short grass, walking across the lawn to a car or something, if you're in a tick endemic area, you're at risk. So let's think about what we can do to prevent that, prevent those tick bites. So we're going to talk about permethrin, but in the context of treating clothing, which is a lot safer for everybody. So it's pretty incredible the effects that this has. So I highly recommend this. Just treating sneakers and socks decreases the chances of a tick bite by 73 times. So that's incredible. So if you go outside, and again, just use the permethrin on, you can also do clothing or materials, spray your tent if you're going to go out camping, or your bag if it's something you put out in the grass if you're outside, or if you're, if you're a logger and you have a tool belt or something you could spray, that would be great. And so the idea is that if you do it, it lasts 6 weeks. So I put it on my calendar. I get all the sneakers and shoes out there, boots, spray them down, keep everybody away from it, wear gloves. If you get it on your hands, just wash your hands with soap and water. It's going to be okay, but it is toxic to our skin. So then you let it dry, maybe an hour or two. It's dry. You can put it indoors then. It will still repel ticks, but it's okay for pets, for people. And so this can be incredible. Again, this is one of the top things I recommend, and my patients come back and they say that it just made all the difference for them. The other thing you can do is send your clothes out to a place called Insect Shield. And when they do it, it lasts 70 washes. So a lot longer. They don't do shoes. But if you send out to them, then if you wanted, you could have a whole, an outfit. If you're somebody who's really out there all the time, I would recommend doing, a full outfit, hat, everything. Get that treated and use that. And then, so we have a study from North Carolina that using this factory-based technique, which is a little more effective, these people had a 99% decrease in the rate of tick bites during work hours by wearing these clothes. So that's incredible. Okay, so let's move on to thinking about essential oils, a nice option if we can use it for tick bite prevention. That's not toxic to our skin. So again, we have this issue where there are a lot of studies actually, which is great, but it's hard to compare them regarding the methods used or the concentrations or whatnot, or even the information that they provide about the study. So, we need a little bit more standardization there to understand what works best and how to go forward. But overall, things that they see are that larvae and nymphs are the most susceptible to essential oils opposed to adults, which is kind of interesting. And they have animal studies showing no adverse reactions in 86% of them. One of my favorites right now, with all the studies considered, is Texas cedarwood oil. So it has a 100% kill rate of black-legged ticks, but that's on contact, right? It's safe to spray on humans and pets over 15 pounds. You do have to apply it more often, right? Of course, we know about DEET, Picardin, these things are very effective. And some of them you can, get a little more time out of them for protection. But if you want a natural alternative, you do need to spray this on more often. So that's the downside, every 1 to 2 hours for it to be effective. But if you do that, it is just as effective as DEET. So that's fantastic. So you can use this instead of DEET. Yeah, and a lot of people use it on their dogs as well. And now Nucotone again, back to this magical potion that I hope will be out there commercially available soon. So it repels ticks for 3 days. So from 1 to 2 hours to 3 days is pretty mind-blowing. So it's 100% repellents for 3 days of adult, both the black-legged and the Lone Star ticks, which is awesome. So hopefully it'll be coming out. You can check out the website, and I'm on there for notification for when it is out. And that should make a difference in our lives. Okay, and in the meantime, so you're doing some things to prevent the bites, but then you come in from the outdoors and we want to do a tick check. And you really need to be very thorough. So, some people's tick checks are not too thorough. You know who you are. So step up your game a little bit. Think about places that ticks might hide. I see a lot of them in the belt area, behind the knees, under the bra line and around the ear and scalp. So those are often where I see people getting tick bites. So I had somebody that was like between the toes. I mean, they can be anywhere, right? So especially they like to be where it's moist and dark and warm. So check those areas. And then in kids, a lot, for some reason, they end up coming in with them in the hair and the scalp. So go through the hair. If you have a family, get everybody lined up. Everybody does their tick checks when you come in. Help each other out. Look through each other's hair. Look on the back. Use a comb. Also your hands, right? So it's not just looking, but also feeling the contour of your body and knowing what bumps you might have and what bumps you don't have and what might be a tick. All right. The other thing you can do, so if you come in from the outdoors, you're doing a tick check, you've got your clothes, right? There could be ticks on the clothes, so you can put them right in the dryer. Put it on high heat for 6 minutes. 6 for ticks. So make sure that if you want to do that, you don't put them in the washer first, because when they're in the washer, then they will be nice and moist, right? They'll live very happily through the wash, and then you need to dry them longer, at least 55 minutes. And then you might have some ticks in your washer, right? So if possible, skip the washer first, go right to the dryer, and then you could go back to the washer after that. But we want to kill those ticks because they don't like to be dried out. So that will desiccate them. That will kill them by drying them out. Okay, so hopefully we prevented a tick bite, but if you forgot to do any of that, then if you got a tick bite, what do we do? So let's talk about that. So here's our little it's starting to get engorged there, right? You can see that gray abdomen. This is our black-legged tick. It's been in there a little while. I do want to mention this. We don't have all day, unfortunately, because we could talk about this for many hours. But just to mention that there are 2 standards of care out there regarding what to do after a tick bite and for treatment, and diagnosis of Lyme and tick-borne disease. So IDSA, Infectious Diseases of Society of America, which also goes along with the CDC guidelines, is one standard of care, and the other is through ILADS, which is the International Lyme and Associated Diseases Society, of which I'm a member. So I've received amazing education through them, and they educate doctors and healthcare providers and have information as well for the public. So please, go to ilads.org to learn more about that. So we will be talking about these 2 standards of care. There's a lot of literature out there, like what I mentioned about the round form of Lyme and the biofilm. I mean, there's research studies in reputable journals about this information, and it's very important to know about that because of the way we treat. But unfortunately, for instance, that's not talked about regarding IDSA and the CDC guidelines. So I want to get that information out to people that you will run into these 2 standards of care if you got a tick bite or if you have symptoms after a tick bite, unfortunately. Okay, so let's talk about the 6 steps after a tick bite. So first, of course, I'm going to remove the tick bite as soon as possible, but save it. Get a bag, get something to put it in. Some people put a piece of tape around it, whatever you have to save it. You don't have to kill it, but just save it. So remove it and identify it if you can. It's nice to be able to identify. You can go to tickencounter.org is a great website that has some great pictures of the ticks to help you identify which one it is, because it just gives us good information about what pathogens it might be carrying or not. And then my favorite tool is the OTOM tick twister. So this you can use to remove the tick. It seems to be the best to quickly remove the tick and without agitating it. So things are talked about like burn the tick or put Vaseline on the tick and smother it. So these things are agitating it. It might release saliva into you, which is where the bacteria could be or the pathogen can be. So we don't want to agitate it. I've, gone through tweezers, and it can be a nightmare trying to get these ticks out. So this is my favorite tool. Next, apply first aid. So you can use a tincture of andrographis. This is a plant that has anti-Lyme activity. You can put that right on the tick bite. We're also going to be talking about something called deer tick bite formula, which you could also, if you have, you can put that on the tick bite. If you don't have either of those, you can at least use an antiseptic like alcohol, right? Or you could use peroxide, something. But the idea is not to touch it and point at it and itch it, because this is an unfortunate image. But when you have a tick attached, it can release feces onto the skin. And in those feces can be the pathogens also. And if you start touching the area, you could drag the feces with the pathogens into the wound, which can give you another exposure. So, and then also people just tend to say it heals better, they don't itch, etc., when they apply andrographis or even an antiseptic to the bite, which is nice for healing. The other thing you can do for first aid is use homeopathics. So Ledum 30C, you would use 3 pellets under your tongue 3 times a day for 3 days right after the tick bite. So it's nice to have at home in case this happens. If you did get some swelling or heat or a rash around the bite, you can also add apis, and you can take them both together. Now, of course, please know that these are not going to kill Lyme and be the be-all end-all treatment if you actually had any pathogens transmitted, right? But this is going to help, right away to have on hand to make a change in your body's immune system and way to respond to that bite. So it would be beneficial in that way. Of course, if you had that rash, while you can add apis, you may need full Lyme treatment. So please seek medical attention for that. Okay, so you've saved your tick. So now you can test the tick. So you can find out what pathogens it's carrying. So I love Tick Report. They're out of Massachusetts. They have excellent testing. It's PCR testing. Technology is a great option as well. It takes 3 business days to get the results. So you fill it out online. Of course, you have to mail in the tick, and then you get an email back with the results. So maybe your tick isn't carrying any pathogens. That would be great news. Or maybe it is, and then you know which ones they are and what symptoms to look out for or what prophylaxis to take. So now we can think about, do we want to begin treatment? Do we want to do some kind of prophylaxis treatment? So if you don't have symptoms, you may want to still take some action in this way. It's up to you. I work with a lot of people, and everybody really, feels differently. Some people have already had Lyme or know people who have had Lyme and had a really hard time with it, and they want to be really proactive. So, that's great. Some other people just want to watch and wait, and that's okay too. So just to give you the options, you can think through it or think through it with your healthcare provider. So the pharmaceutical treatment, this is the ILAD's guidelines. So you won't come across this if you go to the urgent care, ER, or normally your primary care, unfortunately. But what the ILAD's guidelines say is to consider a 20-day course of doxycycline after a tick bite, especially within 48 hours. Now, while we could do that, I recommend also, or instead of, taking what's called the deer tick bite formula. Now, this has a list of herbs in it that helps your body to kill the pathogens that can be transmitted by a black-legged tick. So, as you might know, herbs have many different properties, many different compounds that work in a lot of different ways. So whereas an antibiotic like doxycycline has been created to really work in a particular way, and it might do that very well, these herbs are helping your immune system work better in the face of Lyme disease or other tick-borne disease, which is very different, which is of great benefit, of course. It also targets the spirochete form of Lyme and the round body form of the Borrelia. And then thinking about the black-legged deer tick, we're going to think about these other pathogens it could carry, and also targeting biofilm to some degree. It also protects joints and the neurological system, the liver, things that are really helpful in the face of Lyme or tick-borne disease. So in creating this formula, one great resource is Stephen Buhner, Healing Lyme. He has some other books too. He's amazing. But also there have been studies more recently in the last 10, 20 years, which has been really nice to see that coming out around herbs and specifically Lyme and tick-borne disease. Now this is one called Cryptolepis, and I really enjoyed learning about this because Cryptolepis has been used for the treatment of malaria in Africa for a long, long time, and there's a lot of research on it, and it's very effective. And it's been shown to be protective when used as a prophylaxis. So what I was thinking was, well, if we know that it treats malaria and it's used as a prophylaxis, and then we have other studies here that are coming out where it's actually effective against Borrelia burgdorferi, then why don't we use this as a prophylaxis for Borrelia Lyme and other tick-borne disease, right? So there's some more recent studies looking at Cryptolepis, and then Juglans nigra is black walnut, Polygonum cuspidatum is Japanese knotweed. We've got Artemisia, Uncaria tomentosa, that's cat's claw, Cystis and Scutellaria, Baikal. So it's Chinese Baikal skullcap. So those outperformed cefuroxime and doxycycline against growing and non-growing forms of Borrelia burgdorferi. So this is wonderful, that we're having studies come out of Johns Hopkins now that are being funded to look at botanical medicine. Yeah, we could go down that path, but for today we're focused on prevention. So thinking about the formula to create that I created way before this actually, so this was just extremely validating. We also look at other studies like how Cryptolepis and Polygonum, which is knotweed, are effective against Babesia. So great. So let's see, what am I using in my formula? Yes, we have the Cryptolepis, and we have the Polygonum, which is knotweed, and then cat's claw, which was also mentioned, and then Houtunia. So thinking about, and actually now we can even update that further, but anyhow, looking at the target, the target pathogens. And, if we do simplify it, of course, these herbs are doing more than that, which is important and excellent. But if we're really just looking at the antimicrobial effects, this is what this slide shows us. And then this is the dosing. So, for those of you out there who might be herbalists or be interested in creating an herbal formula, I have that information in the book, how to do that. The deer tick bite formula, you could also just buy each of these ingredients separately, although some of them are hard to find, like Cryptolepis. Or you could purchase this in and of itself. And so then you have the dosing there. So after a tick bite, it would be 1 teaspoon 3 times a day for 30 days. And then some people, will take this, if you're a high-risk population, you might want to consider it daily during tick season, so to speak. Okay, step 5 after a tick bite, we're going to watch for symptoms. So this is a long list of symptoms. We've reviewed the signs and symptoms of the top 3 tick-borne diseases, and here it is again. Of course, report that to your healthcare provider, hopefully a Lyme literate healthcare provider if that happens. And then step 6 could be get tested. So this may or may not be necessary. If you have a erythema migrans Lyme rash, that we don't want to wait to get tested, because this is quite a story unto itself. But for lab testing, Lyme is not going to be accurate until 4 weeks after the bite. So if it's 1 week, 2 weeks in, and you have an erythema migrans or obvious fever and joint pain or something like that, we want to just treat you. We do not want to wait or do a test at that point and then it's negative. Unfortunately, I hear that a lot. Oh, the test was negative, but it was only 2 weeks after the tick bite and you have symptoms. Let's treat you, right? So anyway, each test is different. Anaplasma, like I said, is actually easily tested, or accurately, I should say, tested early on. So that's fine. But each pathogen is different. It just depends. So yeah, so a tick preparedness kit. So I do I do make these, and it has all of those in that we talked about, going through the different steps. It has all of the contents that I talked about, which is a nice pairing to the book. All right, so now we're almost there. Thanks for hanging in with me. I hope this has been helpful. We're going to just cover a little bit about acute Lyme and tick-borne disease treatment for those 3 diseases that we've talked about so far. So here we go. Lyme disease or borreliosis. So again, just to mention the 2 standards of care, IDSA or CDC versus the ILADS guidelines. So just to highlight again a little bit about the ILADS guidelines, there's evidence indicating 20 days of prophylactic antibiotic treatment is highly effective for preventing the onset of Lyme from a black-legged tick bite. But really, patients with Lyme might be served best by receiving several weeks of antibiotic therapy. And so because there is a such thing as chronic Lyme disease, it really requires individualized treatment. It really takes a skilled practitioner to review the history and the symptoms and which pathogens might be present, testing or just looking at the clinical picture to really carve out the right treatment for you. So here we have our shapeshifter again. We've got the spirochete form, the round form, and the biofilm for Lyme. So we'll talk about Lyme treatment first. So this is just like a typical template for acute Lyme. So I work with people with acute tick-borne disease as well as chronic. So chronic infections might be a different story. I mean, we might start here for sure. It could be a good template, but it just could look very different. If you came in with an erythema migrans or acute fever, and we're going to get started, that's what we're going to talk about here today. So doxycycline, please note that there are some avoidances of calcium and calcium magnesium products because it interacts with doxy. And you can also have some sun sensitivity, so just something to watch out for as we get into the summer. That's very important. It seems like sunscreen doesn't work so much, but like if there's zinc in it, you really need that blockout effect of the white zinc oxide. That is more effective, or just clothing to protect yourself. Now there are other options, if there's an allergy, or if you're near the equator during the time and we're just not going to chance that sunburning, because it will happen. You can use cefuroxime or zithromycin. And then I always add nystatin, so that's an antifungal. So the doxycycline can, obviously cause some trouble with the microbiome, and we want to decrease that fungal overgrowth if it's going to happen, especially in women, because sometimes, if we're doing a start of 30 days on a plan, that's a long term for antibiotics, and so we want to protect you from getting like a yeast infection. Then we can add to that. So there are many options. That's the thing. There are many options. This is just one way to go. We can use what I call Lyme formula, and that has cat's claw, Chinese cat's claw, Japanese knotweed, and andrographis. And as Stephen Buhner has put together his amazing work on this, there's literature on how these are effective against Lyme, and so we could use that. Or because it's paired with doxycycline, we could use grapefruit seed extract, which gets to the round form of Lyme. The herbs here, they get to both the round form and the spirochete, whereas doxy is just getting to the spirochete. Now, for people who are really suffering with symptoms, we might want to add this Lyme too. So it also has puraria and red sage and Baikal skullcap, and those can be really useful if there are a lot of neurological symptoms, or if we want to boost their immune system just a little bit more. So that's optional. And then serrapeptase is going to be our anti-biofilm agent. So that would be important to add to break through the biofilm. And that must be on an empty stomach. And then probiotics I always add in order to also mitigate those effects of the antibiotics. So now we're going to go through anaplasmosis and that treatment. So acutely, which is really, we don't see chronic anaplasmosis like we do with some other tick-borne diseases. So again, high fever, worst headache of your life, go to the ER, get tested, treated right away. People do very well. So it's doxycycline. The thing is, doxycycline is really almost the only appropriate treatment. It can be used in children. There's just a side note. We don't have too much time, but there was some older thinking based on tetracycline, not doxycycline. They're in the same classification of drug, but there was this thinking where it can affect the enamel of teeth and not to give it to children under 8 years old. But there is a lot of newer studies showing, no, actually you can. And this is really important actually with a different disease called Rocky Mountain spotted fever. It's so important to treat people as soon as possible for these tick-borne diseases. Anaplasma, you could use rifampin. It's an alternative. It is not in Rocky Mountain spotted fever. You need to use doxycycline. So anyway, just to say, not to limit the efficacy, you can't use cefuroxime for anaplasmosis. So it's really important to get the right drug. Okay, so we've got doxycycline, and then also you can add nystatin as an antifungal. And then we've got some herbal support you can use. So there's houtunia and red sage, astragalus, puraria, which is also called kudzu, and baikal skullcap. So these can be effective against anaplasmosis or ehrlichiosis for that matter. And then we need some antibiofilm effects, serrapeptase, and the probiotics to come in because of the change in the gut flora. All right, so our last pathogen that we're going to talk about for today, acute babesiosis treatment. So again, babesiosis is from a parasite, babesia, or a protozoan called babesia. So it is treated differently from Lyme or anaplasma. So it's important to know if you have this and to treat it properly. Atovaquone is used and with azithromycin. So you need both together. And again, there are other options, but this is, for the sake of today, the template of what to go to first. So atovaquone, just a note to take it with fat to make it more effective. Do not take it with CoQ10. It will decrease the efficacy. And you may, it's really long-term use. You need to check liver and kidney function. Azithromycin is just once a day, not twice. A lot of things are twice a day. And then, so that's the, the pharmaceutical, those two together are the pharmaceutical protocol for babesiosis. Then we can also add some herbal support with babesia formula, which is cryptolepis, seta acuta, and bidens. And I use that a lot. Like when we move on to if we're dealing with chronic Lyme, or if we need to treat a little longer, I will, transition people from pharmaceutical inclusive protocols to herbal or natural therapies. So, we might start with pharmaceuticals and then move on to babesia formula. There are a lot of ways to do it. But before I forget saying this, it's really important to treat 2 months past the resolution of symptoms, whether it's acute or chronic. So if you had a bullseye rash for Lyme, for instance, something obvious, or, just the fever and flu-like symptoms and some joint pains, whatever it is, we want those target symptoms to resolve. And then that's where we start the clock on the 2 months. Now, it might only take a week or a few days for those symptoms to resolve in acute issues, which is great, right? But you need to count those 2 months. So in those 2 months' time, we don't necessarily need to use pharmaceuticals the whole time. I'll often move on after the first month of pharmaceuticals, depending on the situation and what we're dealing with. Everybody's different, right? but we might then move on to the herbal antibiotics at that point. Okay, that was important to say. So back to babesiosis. So we've got the pharmaceutical protocol, we've got Babesia formula, and then we've got also, because it's very useful for Babesia because of how it affects the red blood cells, getting that red sage, that Salvia miltariza root formula in there can be very helpful. And then serrapeptase, just like with everything else, as one of many options as an anti-biofilm agent to break through that biofilm to get to any of the pathogens that are in there. And then the probiotics, because you've got that azithromycin in there to balance the gut flora. And just to note, the atovaquone is anti-malarial, so we don't see too much in the way of change in gut flora so much with that as we do with antibiotics like azithromycin or doxycycline. But it has been shown with babesiosis treatment that the atovaquone and the azithromycin together just work better. They synergize in a way that gets to the Babesia pathogen better. All right, well, I think we've covered all of the tick-borne disease treatments for today that we have time to cover. So please join me. Let's end the Lyme and tick-borne disease epidemic through prevention. Please spread the word. I really hope that you have a healthy, happy life, free from tick bites and tick-borne diseases. You can find me at dralexischesney.com. Thank you so much for your time. I hope it's made a difference.
Great. Thank you so much, Dr. Chesney. That was some great information. So I took a lot of notes during your
Oh, great. Thanks.
So we've got about 12 minutes or so for Q&A. So if anyone would like to ask any questions of Dr. Chesney, you can raise your hand in Zoom and we will try to get to your questions. And real quickly, so how does your protocol differ from the protocol of most medical professionals when someone comes in fearing that they may have been exposed to Lyme?
Right. So it can be a range even for those folks. You may just be told to watch and wait, or you may be given a one-time dose of doxycycline after a tick bite, which that study is not very effective, it doesn't give confidence. So it's a flawed study. I'd recommend any health care providers to read it. Yeah, so they might get a one-time dose. If they have symptoms, I hear all sorts of things. They might be given 10 days of doxy. They might be given 14 days, but they might come back to their provider saying, well, some of my symptoms went away, but not all of them. And they may not be given more treatment. And also, anyway, the round form and the biofilm are not being treated. So that's not going to be an effective treatment necessarily. Or what if there's Babesia there? It's not being treated. So, there needs to be more critical thinking. But if a panel's given, sometimes they pick it up. A blood test panel at a later date, they might pick up Babesia and treat that properly. Yeah, it's really all over the board, I have to say.
Yeah, so
that's when I see someone, because they say, I think I still might have this, and this is what I was given. I'm like, you're only given one dose, and you had an erythema migrans? Oh my goodness.
Yeah, it gets definitely a little confusing out there. A lot of people that are on this, that are following this conference are very reluctant to take antibiotics. And you talked about essential oils as being an alternative. How do they compare as far as their efficacy in, either prophylactically or with dealing with the symptoms of Lyme disease? Is essential oils an alternative to antibiotics, or do we need to take antibiotics? Should we get?
Yeah. So are you meaning essential oils or herbal botanical medicine?
Or herbal botanical.
Maybe both.
I'm sorry.
Maybe both.
There you go. No, herbal, whatever the alternative is. How about that?
Sure. So yeah, because there are also, I don't know what the question is coming in. There are also essential oils that you can take safely orally that can be an option as an alternative. And there's research on that. It's just so great. I've been in practice since 2010, and I have mentors that I've learned from. And, you see in practice, that these herbal treatments and these natural therapies work clearly, right? And then there's some research to come out, which just feels really validating, and can gain some more access to just the medical field at large, and people at large to see that it really works. So yeah, what I see typically, and I do use pharmaceuticals in the beginning of acute Lyme and tick-borne disease. I do see that there's something to that. I've had patients, and I happily work with them, after we talk about it, they may not want to do that, and we may choose to do a natural therapy right off the bat. And sometimes that's been just fine. Occasionally it's come back and we've said, you still have these symptoms. It was acute. It should be easily treated. Let's do the antibiotics. And they may do that, and they may see a difference. And that's acute, right? So if we're talking chronic, if somebody sees me who's been sick 10 years, 20 years, they've been to many doctors, nobody knows what's going on, or they had pharmaceutical antibiotics in the past, but are still sick, often we'll start with natural therapies because they're going to be more effective later on for sure. Sometimes I just like to capture that moment where the pharmaceuticals are most effective right after a tick bite acutely. I hope that helps.
Thank you. Yes. So Lyme disease is known for being difficult to detect. There seems to be different criteria based on who you go to for whether or not you have Lyme disease. What makes Lyme disease so uniquely difficult to diagnose and even define, and get agreement among the medical profession? And then what advancements in diagnosis and treatment have you found promising in your practice?
Yes. It's a little bit of a mystery, and there are a lot of different ideas out there as to why why this is so hard, right? Doesn't necessarily make sense. But regarding everybody getting on the same page and having access to the same treatment, and utilizing, this knowledge that is out there, that's a little bit of a head scratcher. But yes, we could get into all sorts of theories on that. But to stay in the solution today, I would say regarding testing, that's one of the issues. So testing, the ELISA test is usually the first test that's done by a conventional practitioner, and that one's less than 50% accurate. So we didn't have time today to go into all this, but that's certainly important. And it is actually, like, if you read the test, what's included there is to say this test is for surveillance. So this is not a diagnostic test. It says that on the test. However, practitioners are using it as a diagnostic, meaning it's really used for epidemiology, for public health. Like, all right, how much Lyme disease is out there, right? Let's see. But it's not a test that should tell us you have Lyme or not. It does not rule out Lyme. And unfortunately, practitioners use it that way. Actually, everybody's in agreement that this test should not be used to rule out Lyme. So if it is positive, yes, there's Lyme. You've been exposed to Lyme. If it's negative, nobody should use that test, and no one's actually being told to use that test to say you don't have Lyme. So that's annoying. That's confusing. So there's that test. It's really a clinical diagnosis, and the CDC says this is a clinical diagnosis. It's not just about this one test. So it's about putting that in action and having proper education about it. So we're using the clinical picture, meaning the symptoms, what happened? Hey, you had a tick bite. Oh, and then you got a fever. Let's treat you. Let's not wait for this test that's not very accurate to come back. Then the timing of the test. So you have to wait 4 weeks after a tick bite to even get that horrible accuracy anyway, whatever the accuracy is, which is it's like 20 to 50%. But it'll even be worse if it's not done 4 weeks after the bite. There are better tests. So I use the Western blot. You can actually order a Western blot at a regular hospital or Quest Diagnostics LabCorp right off the bat. However, some hospitals, which I've run into, they will not do it. So for instance, Quest Diagnostics, if a practitioner goes in there and orders, like, this is the test I want, that is the test that will be given, which is great. I've had problems with hospitals where I choose that test on my order form and I do not get that test back. They do the ELISA test and I say, I don't want that test. I want the other test. And they say, well, we won't do that for you, which is really a problem. So that's a long story, but making sure you get that Western blot, which can sometimes be hard to get, is the thing. And that's going to be a little better. That's going to be 60 to 70% accurate. So better than that other test of the ELISA test. Even still, right? So you get a positive, okay, it's positive, but you get a negative, it doesn't rule it out. So we have a company called IGeneX I work with, IGeneX. They've been doing this for a long time. They have a Western blot that is 90% sensitive. So it is usually out of pocket. It's covered by Medicare. That's the Medicare Part B is the only insurance that covers it. Otherwise, it's out of pocket. It's $450. And then you have to find a doctor. You can find a doctor at ilads.org if you're looking for a Lyme literate specialist. And then they would be aware of these things, hopefully, right? And they might order that test. If you ask your conventional doctor to order from IGeneX, I doubt it's going to happen. But anyway, that exists, and that's a much better test. So now we can say, oh, 90%, okay, maybe this can rule it out or rule it in. But still, I'm going to be looking at the clinical symptoms. And then also just to squeeze in, because it was exciting, last year, 2023, we now have a culture test from IGeneX, and that is the gold standard to tell us, do you have a pathogen? Do you have this infection, right? A culture. So it's looking for the actual bacteria. And now we have that ability. So you can also get a Lyme, or actually it's called borreliosis, because it's looking for all Borrelia, which is also really nice because it's more than Borrelia burgdorferi, which is why some of those other tests are less accurate. So it looks at all Borrelia and can tell us, do you have an infection now? Because all the other tests, even the better accuracy tests, are just telling us if you have been exposed. They don't tell us if you have Lyme now. And maybe that's all we need to know because we have your symptoms as well. But for people who have had Lyme in the past and seem to have resolved it, it becomes a problem then. How do we retest? And that's where we use the culture.
So all right, so we have about 1 minute, so I'll just ask to be brief, which I know there's so much information on this.
Yeah.
But real quickly, what might be some of the reasons why some people are symptomatic and others are not symptomatic when they have Lyme disease?
Yeah, so I mean, we need a robust immune system in order to mount a response and have symptoms. So that's a player, I've had patients who have immune deficiency syndromes, diagnosed clinically, and yeah, who knows when they had Lyme, but they are dealing with it as well. And if you don't have a robust enough immune system, you may not get symptoms. I mean, that could be a small part of the population, right? And also, it can be blamed on other things. I mean, with COVID, I've been having these conversations with patients a lot. Oh, I had COVID, but then something else, and I had a tick bite, and then I had RSV and an upper respiratory. It's like, there's so many infections out there that you could get, and trying to decipher what's what, can be hard as well.
Great, thank you. So, all right, that wraps up our time. So thank you so much for sharing that information. And real quickly, what was the website where people can find the practitioners?
Yes, so ilads.org, ILADS.
ILADS.org.
.org, yes.
Okay.
There's also, so that's the medical society that I was talking about, the other guidelines. So you can go there and fill out a form to find a practitioner near you. Yeah.
All right, great. Thank you so much for all the information that you shared with us today. If we could unmute the audience so they could share their appreciation for Dr. Chesney, that would be appreciated.
What do you
Thank you so much for your time. So smart.
Thank you.